Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief expert video will spotlight the daily hot topics from the conference.
Hello, I'm Bill Powderly from Washington University in St. Louis, and I'd like to welcome you to the first of two clinical clips from the European AIDS Conference in Warsaw. There has been a lot of interest in new drugs for the treatment of HIV. One particular new agent is islatravir, which is a nucleoside reverse transcriptase translocation inhibitor. And a number of trials were presented at this meeting. One in particular, the 96-week data of a switch study in which patients stable on bictegravir TAF-FTC were either continued on that regimen or switched to the islatravir doravirine combination. At 96 weeks, virologically, they were quite similar, and the islatravir doravirine combination was non-inferior. However, there was a significant dropout of patients who had a loss of CD4 cells or did not have the expected rise in CD4 cells. And this was due to lymphopenia that's seen in a subset of patients receiving this investigational agent. This was replicated in a number of other reports that were at the meeting in other patient populations. And it suggests that although this is a very promising agent from a virological perspective, the doses that was used is not one that can be brought into further clinical development. And future studies will investigate a lower dose, 0.25 milligrams a day, with doravirine of this particularly promising agent. There has been a lot of interest in simplification to two drug regimens, but most of the simplification strategies involve integrase inhibitors. And there is some interest in whether other classes of drugs could be used in a two-drug regimen. In particular, the ANRS from France started a study to investigate whether the use of tenofovir FTC could be used as a simplification strategy in patients who were suppressed but initially had a low viral load, less than 50,000. This trial started just before COVID and was affected by COVID in terms of enrollment of patients. So very preliminary data out to 6 months was presented at the meeting. It did suggest, however, that simplification to tenofovir FTC might be a strategy worth pursuing. And given the fact that some patients have significant metabolic and cardiovascular problems with the integrase inhibitors, it is important to continue to investigate these strategies. The Swiss HIV cohort has been examining issues in patients for many years. One particular clinical question they addressed was whether or not viral failure was more likely in patients who had what we refer to as blips, that is a viral load between 50 and 200. And their extensive experience suggested that, in fact, this was a patient population that had a higher risk of viral failure, about a 3.5-fold higher risk compared to patients who did not have blips. And that was a greater factor than just the regimen that was chosen or adherence. Most patients did not fail, but it is important to recognize that patients with these blips should be monitored closely for the possibility of failure. Another study from the Swiss HIV cohort really showed us where we have come with HIV. They analyzed the causes of death between 2005 and 2022 in the cohort. And they looked at 3-year groupings And so if you look at the last 3 years, from 2020 to 2022, and compare that to the first 3 years, what they found was that the deaths due to HIV-related conditions had fallen 5-fold, reflecting the availability and early treatment of HIV. Deaths due to liver disease had fallen 7-fold, which reflects the availability and potency of effective treatment for HCV. In contrast, cardiovascular deaths were stable, and the deaths due to non-HIV cancers, particularly lung cancer, had increased 2-fold. This reminds us that with a patient population that is getting older, and one of the reassuring things was that the average age of death had increased from the mid-40s to over 60. It is very important for us to think about the non-HIV related issues that our patients may develop as they get older, particularly cardiovascular disease and cancer, and routine screening and prevention strategies for these remain an important part of the care of HIV patients. Thank you for joining us for episode 1. Please refer to the landing page for slides, and be sure to come back tomorrow for our second episode from EACS 2023.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.